So I guess the big news yesterday was the full authorization of Pfizer, and we had been waiting, hopefully, for this to come soon. And the reason we were so eager to have this happen is that it should provide more confidence to people who have been waiting to get vaccinated. That this vaccine is been tested in the most rigorous way possible, and been approved, with 8 months plus of people getting this vaccination in very high numbers. It's really been evaluated, and the others as well, more rigorously than most vaccines that do get full approval. And so we're looking forward to not only having an uptick in the vaccination rate in our county. We're thrilled and proud that we have 80% now of adults vaccinated in the county. I know that was a goal of our health officer, to be there by now. And but we know that when you look at the whole population, that still has us below 70%, and we need to get the rest of the way. So we're looking forward to kids as well being approved for under 12, hopefully within the next month or two, so that we can really up our numbers significantly. We stand ready for that. But go to aacounty.org/coronavirus, and you can click on the link to make an appointment. There are lots of sites that they have available, and it's very easy to find a place and very convenient. So, and we also encourage, particularly now that we have the full authorization, encourage employers to mandate for their employees, and we encourage businesses to consider mandating for folks who are coming in and using their businesses. It's been done in restaurants. Our Annapolis Symphony is requiring vaccination or recent testing in order to attend now, and I think we'll be seeing more of that. And I think we need to see more of that. And Arundel County, as you know, announced the vaccine requirement for our employees back on August 2nd, and that will be taking effect in mid-September. So that should up our numbers significantly. And I just want to say something about people's attitude right now. It's the Delta variant has hit us at a time where we thought we were close to being through and life back to normal. And this is not something that we can control. It was something that we were warned about by our public health folks, that if we didn't get vaccinated quickly enough, that these variants would continue to mutate and be created. And this one is certainly moving fast. And so it does mean that people who don't get vaccinated are very likely to get infected with the Delta variant. And as we saw when our case rates went up, we said that there would be an increase in hospitalization in the coming weeks, and that's happened. We're up to about 50 hospitalized COVID patients in the county. We had gotten down around 10 during the earlier part of the summer, and those are unvaccinated people. There are some who were vaccinated, but all of those, I'm told, have other underlying conditions that made the virus much more serious for them. So please get vaccinated. As I've said during the fall surge and every other surge, that our goal is to keep our healthcare system from being crippled by sick folks who need to be attended to. And when our hospitals fill up, that means that they can't serve the rest of us who have other conditions that we need hospitalization for. So we look forward to getting our numbers up. And I am very optimistic about that. I think that we are getting there, and we will get there, particularly in Anne Arundel County in Maryland, where our vaccination rates are much higher than in the places in the country where we've seen these disasters strike in hospitals, and healthcare workers being stressed to a level that they should not have to be. And then finally on COVID, I just want to say something about our school system. Kids are going to be going back, and our superintendent, based on the recommendation of our health officer, has said that masks will be required for all students and all staff in our schools. And I support that wholeheartedly. Most of the kids under 12 cannot get vaccinated at this point. And I know that parents are very concerned about their kids being infected, as they should be. And so it's going to happen. I know the school board has a meeting on September 1st, and I would encourage all the members of the school board to support the superintendent's decision here. We know that based on CDC contact tracing guidelines and quarantine guidelines, that when all the kids are masked, it means that even if they're within 3 to 6 feet of each other and a kid tests positive, they do not need to quarantine. So the reason that so many classrooms and even schools are being closed in places around the country is that those kids are not masked and they do not have mask requirements. So if we want to keep our kids in class and keep our schools open, that's the reason that we have the mask requirement. So quickly, I want to jump over to congratulations to our Department of Public Works. They're the folks who keep things running in our county, and often quietly and not recognized. I think they often don't want to be in the limelight because when things are working, we don't hear about them. But they recently got a series of awards for the wastewater treatment work that they've done, and now they've just received, and I think you all got a press release from them yesterday about the National Association of Clean Water Agencies Directors Award that they just received. And we have with us to answer questions Ben Thompson, who runs our utility operations. So he'll be on hand if you have questions about that. So congratulations to them. And then you heard a lot about our Resilience Authority because it's one of the first in the country, and the Senator Van Hollen was out talking to us about it, and it's important work just last week. And we have posted the job announcement for a national search for the director of our Resilience Authority. And we're working with the city of Annapolis on that as well. And I have our environmental policy director, Matt Johnston, if you have questions about that. If anybody's interested in that job, I know that we're going to be getting one of the best experts in the country because we're one of the first. And there are people out there who really specialize in this work and are excited to get started. And then finally, a couple of upcoming things are budget community forums that we've been doing are coming up September 1st. We're in District 5 at the Arundel Senior Center. And then on September 2nd, we're in District 1 at the Jessup Fire Station with residents talking about the things that are in the budget for their communities and talking about implementation and about their hopes for next year's budget as well. So thank you all. And I believe I am turning it over to Dr. Kalyanaraman for further COVID comments.
Thank you, County Executive. Always a tough act to follow since you know all the COVID stuff, but I'll give you a little bit more of a detailed rundown on where we are. We are seeing that our hospitalizations are up to 55 between Anne Arundel Medical Center and Baltimore Washington Medical Center, and we've been talking about the fact that hospitalizations are really what we're going to key in on, particularly as more and more people get vaccinated. That said, our case rate is up to 17, and that's really important because it means that there's a lot of spread. We are now in the highest category of spread for the CDC, and this is particularly relevant as we're coming up on school opening. We want to make it so that not only can kids get back into school, and they will, but that they're able to stay in classrooms, right? If we're seeing spread in classrooms, that means kids are going to need to both be off to recover, but also to be quarantined. And that's why, as the county executive noted, masking is going to be critical, and we're really happy that that the superintendent put into place the masking requirement. That's going to mean the kids who are close contacts but are masked do not need to quarantine. They can stay in school. That's important for them. It's also important for parents because, as you all know, and as I know, it's been really hard to juggle having kids home during COVID, and it helps us stay at work when the kids stay in school. We're also seeing that as our hospitalizations have gone up, we've had 6 deaths in the last week, which is the most deaths we've had in 3 months. And that's a consequence of the severity that we're seeing. It's particularly important because the vast majority of people who are hospitalized are unvaccinated. And so with the FDA approval, full approval of Pfizer, the single most tested treatment ever to get approval, hundreds of millions of doses have been put into arms. That's an amazing safety profile, and an amazing efficacy profile. Just as a point of reference, the COVID vaccine is more effective than the flu vaccines that we get every year, which do a great job of protecting us. And so if you've been on the fence about getting a vaccine and you were waiting for FDA approval, it's come now. So please come get your shot. Um, it's going to be the key. It's going to be the key. And as particularly as we're waiting for kids 5 to 11 to get vaccinated once the FDA approves that. The other piece with FDA approval is that businesses really can do the vaccine mandates for staff. They were allowed to do that with the emergency use authorization, but it just makes it that much easier to do so. And we want to really just get ourselves protected and go back to as close to the way things were. The Delta variant is pretty much almost all the cases in the state at this point. There are a few other variants circulating, but it's got over 90% of the cases of Delta that we're sequencing. So it's going to be critical to continue to wear your mask indoors in public settings. It's another layer of protection on top of your vaccination until our case rate comes down. And then the last is we want to encourage people who are immunocompromised to get their third dose. If you're immunocompromised, meaning you've had transplant, you're on immunosuppressive therapies, you have a severe primary immunodeficiency, either untreated or advanced HIV or cancer on treatment, please come get your third shot. You can get them at any location, health department vaccination site, or through pharmacies, or through your doctor. That I will turn it back over to you, Jeff.
Thank you, Dr. K. I'm just going to put in a quick plug before we go to questions. Dr. Kalyanaraman and the county executive will be doing a live stream on COVID and COVID-related questions tomorrow from 1 to 1:30 p.m. You can watch that live on the county executive's Facebook page or on Arundel TV. And now for questions, first up, John Fernay, Ion Annapolis.
I guess this is for Dr. Kalyanaraman. What type of boost are you expecting or a bump are you envisioning with the FDA approval for the Pfizer vaccine? And do you really see this as the game changer that a lot of people are thinking it is?
We're ready for volumes to pick up. I'm hoping that we're going to see a lot more people get it. Is it a game changer? I think that less on the individual level and much more on the business level, it is a game changer. I think that a lot of businesses and organizations have been waiting for that approval to put into place their vaccine mandates for staff, and I think that's where the game change occurs.
Okay, and is Bob Moser on the call?
I am.
Hey, Bob. Question for you. I know that going into the school year, it's all or nothing for virtual. You had to make your decision and live with that. What is in place in case we see students getting quarantined for 10 days because of COVID that are in-person learning that are now going to be falling behind by 10 days?
So, well, they won't be falling behind by 10 days. So our learning management system, our online learning management system, Brightspace, will allow us to provide materials to students and their families. And then we will have teachers checking in with those students to check on their progress. So the hope is that students who are, for example, quarantined and asymptomatic would continue to engage in the lessons that are provided to them throughout the period of their quarantine. They would not be marked absent from school if they do that engagement, and that teachers will be working with them as much as possible to ensure that they can be as close to caught up when they return as they can.
Okay, thank you.
Sure.
Thanks, John. Next up, Ryan Sears, the Daily Record.
This is probably for the county executive, but I suspect that Dr. K will want to weigh in. Since August 2nd, the county's case rate has essentially, transmission rate has essentially doubled. At what point does the county executive, does the county look at wider mask mandates, and what's the metric for instituting something like that, since clearly the vaccination levels are not exactly where you need them right now?
Mr. County Executive, you're muted.
Okay. Yeah, the first thing we have to look at is our ability to do that. A wider mask mandate would be a requirement that in all public places that masks be required, and We don't have the authorization. We had it under the governor's order, emergency order, and we had it under the county's emergency declaration that had been approved and then sustained through most of the pandemic. But that we no longer have. And in order to put it back in place for more than the first 5 days under our charter requires a supermajority of our county council to support it. So that would be 5. We know at least 3 members of our county council have opposed every mandate that we've put into effect, every initiative really to try to combat this virus. So we don't believe that we have the votes on the council to do that. But even if we did, we're not sure yet. We would do what we've done all through this pandemic and consult with the health officer. But it does look like with this case rate that we're getting to a place where clearly the CDC has said that people should be masked in public places, and we would be looking carefully at that if we could actually implement it.
All right, next up, Rob Lang, WBAL Radio.
I guess my question will first go to Bob Mosher, but if the county executive, Dr. K, would want to weigh in, we'd appreciate it. What is the status of a vaccine mandate for teachers and school staff in Anne Arundel County?
Yeah, so good morning, Rob. So it's something that we have discussed here. There are a lot of nuances to it and a lot of details that would have to be worked out if we were to implement that. So those conversations are continuing.
Okay. And of course, for county employees, that mandate takes effect September 14th, if I'm not mistaken. I just want to make sure I have the correct date.
September 13th, Rob.
13th. Okay, fair enough. All right. Thank you all.
All right. Next up, Kate Amara from WBAL.
Thank you. I have a couple questions. So the first one is for the county executive. With the full FDA approval of the Pfizer vaccine, are you considering adjusting your vaccine requirement for county employees? Why or why not? And if the answer is why not, why would you not eliminate the testing option, since clearly getting the vaccine is, as we've heard you say, and Dr. K say so many times, is so important. Why allow the people to even have the option to get tested instead? That's my first question.
Mr. County Executive, you're muted. You're still muted, sir.
Space bar doesn't seem to work. Okay, sorry. So the reason that the testing option was in place was not that we had to do it, but that we didn't want to lose staff who wouldn't get vaccinated for whatever reason. And we have departments where we can't afford to lose people right now. We don't want to cost ourselves services, important services. And so, yes, we are, we are gonna look at that and continue to look at that, but not ready to make any changes at this point. That option, we believe, it contributes to safety in the workplace, to slowing the spread of the virus, while accommodating some folks who we may not agree with them, but we don't want to lose them.
Thank you. That's very candid. Okay, my next question for you is later today. There's a new health clinic which opening at the airport, which will include COVID vaccine and testing. Since that's in your county, I'm wondering if this is a sector, either the workers there or the travelers going through there, if that's a sector that worries you or has been shown to have low vaccination rates or higher spread, since it is such a big place in your county where people come and go every day.
It is a big place and a lot of people do come through, but I'm going to pass that one on to Dr. Kalyanaraman because I know he's been in contact with the airport.
Yeah. So that clinic is being run by a private medical organization. I don't want to say the name because I'm actually not sure of the name, but we've been in contact with them, and it's just another strategy for giving people access to care, and particularly, like you noted, at the airport, you have people coming and going, not just the travelers, but also the essential workers, those folks at BWI. And one of our longer term strategies for COVID is to have more and more of the care, whether it's testing, vaccination, being done by the healthcare system as we transition this away from a public health emergency to a part of the landscape that we can handle as a routine matter.
Thanks. And I promised my last question, but Dr. K, I'm hoping you might be able to answer it. I've been wondering about this. With the full approval for the Pfizer shot, it has a new name, Comirnaty. Will we see that reflected now in your online information, frequently asked questions, or if people have to, register to get a vaccine, is it going to be like now offering Comirnaty and Moderna? I'm just wondering if people need to be on the lookout for that name instead of Pfizer, since it may complicate things more confusing for people. Have you thought about that, your strategy going forward on the brand name?
Yeah, it's been branded as the Pfizer vaccine for a really long time. So for right now, we're not going to change that. We'll probably add that second name as needed, but we're not going to try to confuse anybody. We keep talking about the Pfizer and the Moderna shots.
Thanks, Kate. And before we kick it over to Lily Price for a question, this will be our last question before a quick update from Bob Mosier. Just a reminder, we do have that live stream tomorrow from 1 to 1:30 p.m. on COVID questions with County Executive and Dr. K. So Kate, questions exactly like that. We're hoping to see some of those from our residents too. And now Lily Price from the Capitol.
Hi, County Executive. I might have missed this, but is there a vaccine requirement for county workers now that Pfizer is FDA approved?
Yeah, I mean, we announced that on August 2nd to take effect September 13th, and with an option of weekly testing for folks who do not get vaccinated. So we're putting all that into place as we speak, and it's actually. Anecdotally, I'm hearing about a lot of people and a lot of department heads are telling us about people who are getting vaccinated because they want to be ready for that date when it comes and don't want to have to go get tested every week.
Okay, thank you.
All right, before we close up, Bob Mosier had a quick announcement to share about an event tomorrow.
Thanks, Jeff. I appreciate it. As I think all of you know, we sadly lost one of our board members, Candace Antwine, who passed away in July. There will be a public tribute to her tomorrow night at North County High School at 7 o'clock. The county executive will be there, members of the board, superintendent will be there, and members of the Antwine family. So folks who attend will have a chance to speak with them, and we'll be paying tribute to her life and her legacy of service. So thank you.
Thanks, everyone. We'll see you next week.